Hello everyone. In this video, we will be studying important CD markers. These are very important for the exam. So first one is CD1A. CD1 is linked with thymocytes and Langerhans cells. Then is CD2. We are studying it in serial number, so it will be easy to remember. CD2 is for thymocytes, NK cells, T cells, and B cells. CD1 was for thymos and Langerhans while CD2 is for four cells thymo and NK cells, T cells, and B cells. Then CD3. CD3 is pan T marker and it is for thymocytes and mature T cells and is associated with T cell receptor for signal transduction. Thymocytes and mature T cells. Then CD4. CD4 and CD8. So rule of 8 is followed. So CD4 4 into 2 is equals to 8, so it will bind MSC2 and it is for helper T cells and regulatory T cells. Then CD5. CD5 is for BCLL or SLL and CD5 is positive in the second zone of lymph node. What is the second zone? Mental zone. Then CD7. 7 is T cells. Then CD8. CD8 rule of 8 MSC1 cytotoxic T cells. So up to 8 it is T cells, okay? CD1, 8, 2, 3, 4, 5, 7 and 8. These were linked with the T cells. Then CD10. CD10 is common acute lymphoblastic leukemia antigen, that is common ALL antigen, Kala antigen. It is for pre B cells and germinal center B cells. So germinal center is CD10 positive and mental zone is CD5 positive, while marginal is both CD10 and 5 negative. Then we have CD11 or 18. 11 and 18. It is integrin beta 2, LFA or MAC1 and on neutrophils. CD11 or 18 is also known as integrin beta 2 or LFA or MAC1 and it is present in neutrophils and it will bind the CD54. CD54, that is ICAM1. ICAM1 on the endothelial cells and this will help in leukocyte adhesion. So CD11 and 18, integrin beta 2, LFA or MAC1 on neutrophil, bind ICAM1 CD54 on the endothelial cells and help in leukocyte adhesion. CD18. CD18 will result in leukocyte adhesion deficiency. Then is CD11B. 11B is linked with the complement 3B receptor and is present on monocyte, macrophage, and NK cells. And CD11C. CD11C is present on monocyte, macrophage. And here additional is not NK cell, but here it is granulocytes. Granulocytes. Then we have hairy cell leukemia, also linked with the CD11C. Then is CD14. CD14. First we do CD13. Okay, CD13 is immature and mature monocyte and granulocytes. The CD11B was for monocyte, macrophage, and NK cells. CD11C was for monocyte, macrophage, and granulocyte. While CD13 is for M and G, that is monocyte and granulocyte. Then CD14 is LPS binding polysaccharide, lipopolysaccharide binding, okay, and PAMS receptor. It is present on monocyte and macrophage. So CD11B, 11C, and 14 are on monocyte macrophage and NK cell granulocyte, while the CD13 is on monocyte and granulocyte. Then CD15 and 30 in the Reed Steinberg cell, classical Hodgkin's, CD20 and 45 in the popcorn cells, in the lymphocyte predominant. Then we have CD16 and 56. 16 and 56 on NK cells. And additional on NK cell is 11B. So 11B. B is also looking like 6. So 11B, 16 and 56. That is with the NK cells. CD19. 19 is PAN B. PAN T was CD3. PAN B is CD19. Pre B and mature B, not plasma cells. Plasma cells are CD19 negative. CD20 is also similar, pre-B and mature B, not plasma cells. So what is the marker for plasma cells? CD78 and 138. 56 and 16 was linked with the NK cell. So 16 or 56 that were linked with the NK cell, while 78 and 138 that is linked with the plasma cell. And the CD19 and 20 is negative in plasma cells. Then CD27 we have. CD27 is negative in the B cells, but it is positive in the plasma cells and in the memory cells. Then we have CD21. 21 is linked with the C3D complement. C3b complement which was linked CD11b. Then CD21b. Okay, 11 table we are following. 11, then next one, we add the 10. 10 in that, 21. So C3D complement, that is with the CD21. And mature B cells are CD21 positive. Dendritic cells are CD21 positive. And Epstein-Barr virus. So to drink in the bar, we should be age 21. So CD21 is Epstein-Barr virus. Dendritic cell, mature B cell, and complement C3D. Then is CD23. 23 is activated mature T cell. CD19, 20 all were linked with the B cells. Now 23 comes the turn of the T cells. So activated mature T cells. And CD25 is also activated T cells and regulatory T cells. Regulatory means which prevent the autoimmunity. So it will be linked with the FOXP3 gene. FOXP3 mutation results in IPEX syndrome. IPEX, that is polyendocrinopathy, immune dysregulation, and that whole scenario. So FOXP3 interleukin 2 receptor. Interleukin 2 receptor activated T cells, regulatory T cells. These are linked with CD25. So now FOXP3 we have seen. Then there are two more FOX genes which we need to remember, that is FOXC2 linked with the varicose veins and FOXL2 linked with the granulosa cell tumors. Then is CD28. CD28 is present on the T cell and bind the B7 on the APCs. So this is involved in the co-stimulation, that is activation of the T cells by the representation by the APCs. So on the APCs we will have CDB7, that is CD80 and 86, and they will stimulate, interact with the CD28 on the T cells. Then next we have CD31. CD31, 31, imagine like we say 31, then run. 3, 2, 1, run. So that is PCAM1. PCAM1 and involved in the diapedesis. Diapedesis means running from one place to another of the neutrophils. So PCAM1 CD31 is linked with the diapedesis. Then CD33. 33 is linked with the myeloid progenitors and monocytes. Myeloid progenitors and monocytes 33. Then 34. 34 is hematopoietic stem cells and L-selectin on the endothelial cells bind L-selectin on the leukocyte and help in rolling. So CD34 is involved in rolling, while CD54 was involved in the CD54, 11, 18 that was involved in adhesion. CD34 is involved in rolling, and CD31 is involved in diapedesis. 31 run diapedesis. Rolling is baby's rolling. Hematopoietic stem cell is a baby, so baby's rolling, that is CD34. Then we have 38 and 138. 38 and 138. We have done already 78 and 138. So 38 is also there in the plasma cells. Then CD40. CD40 is present on B cell and macrophage. CD40 is present on B cell and macrophage and results in isotype or class switching. That is, first IgM and IgD are formed. Then the other antibodies are formed by class switching from that antibodies only. So IgM to IgG transformation occurs with the help of CD40, and CD40 is present on the B cell, but CD40 ligand, that is equal to CD154. CD154, that is on the T cells or the T helper cells. Then is megakaryocyte. Megakaryocyte is 41, 42 and 61. 41, 42, 61. Then is 43 with Scott-Eldridge syndrome. 44. 44 is hematological spread and hyaluronic acid receptor. So hyaluronic acid, that is involved in the connective tissue, that will be linked with the hematological spread of the tumor, the metastasis. 44 is for metastasis. 34 was for hematopoietic and rolling. 44 is metastasis and in the hyaluronic acid receptor. 45 is leukocyte common antigen. ALL common antigen was CD10. 45 is leukocyte common antigen in the all leukocyte. Then 45RO. 45RO is in the memory T cells. Then is 54. 54 we have already studied. It is ICAM1 and it will be linked with CD11, 18. That is integrin beta 2 LFA MAC1 and helps in leukocyte adhesion. 54 is with the leukocyte adhesion. 154 is with the CD40 ligand. Then CD55 decay accelerating factor inhibits C3 and C5 convertase, and CD59 membrane inhibitor of reactive lysis. These both are involved in paroxysmal nocturnal hemoglobinuria. 64 is mature myeloid cell. 71 transferrin receptor 1, mesangial IgA1, then is Hinosh-Schönlein purpura and Berger's disease. So what are involved with the CD71? First we have iron deficiency anemia related, that is transferrin receptor. Then is mesangial receptor, and mesangial receptor is linked with the IgA nephropathy, and it is also linked with the Hinosh-Schönlein purpura and Berger's disease. So Hinosh-Schönlein, Berger's disease, IgA, that all will be involved with the CD71. Then is 79A. 79 is mature marrow. 79A is linked with the marrow cells, okay, bone marrow cells, bone marrow pre B cell and mature B cell. Then CD80 and 86 we have already studied, that is B7 on the APCs bind to CD28 on the T cells and results in co-stimulation. CD95 is fast ligand in the apoptosis on the cytotoxic T cell and NK cell. Then is CD99. 99 is Ewing's and granulosa. And what other was on the granulosa cell? On the granulosa cells, we have FOXL2 receptor. Then is 106. 106 is VCAM1. Bind VLA4 integrin on the leukocyte and leukocyte adhesion. So, on the leukocyte adhesion, we had VCAM1 and VLA4, and other was ICAM1 and CD54, 11, 18. It's in adhesion. In the rolling is 34, and in the diapedes is 31. PCAM1, rolling L-selectin and 34. Then diabetes is CD31 and PCAM1, and adhesion 154, and in the adhesion we have 54 and 11, 18 and 106. So 54 roughly double, then it becomes 108, but we short it to 106. 106 and VCAM1, that is also linked with the adhesion. Then CD117 c-KIT mutation, that is in GIST and is also there in the mastocytosis, and extra in mastocytosis tryptase. And CD123. 123 is in hairy cell leukemia, and CD11C was also there linked with the hairy cell leukemia. Then we have CD152. CD152 is linked with the CTLA4, that is binding the B7 and inhibiting the co-stimulation. So B7 was normally binding CD28, but if it binds the CD152, CTLA4, that will inhibit the co-stimulation. 152 is the inhibiting the co-stimulation, and 154 was the CD40 ligand. 154 is normal, 152 is abnormal. Then we have CD207. 207 is in Langerhans cell histiocytosis. What other was there in Langerhans cell? CD1A. Then we have CD56. 56 is Merkel cell cancer. So let's revise again briefly all the markers. 1 is thymocyte and Langerhans cells. 2 is thymocyte NKT, CD3 is pan T cell marker. CD4 is MSC2. CD5 is BCLL, SLL, and in the mental zone, then in the CD7 T cell, CD8 is MSC1, CD10 is common ALL antigen, pre-B and germinal center B cell, 11, 18 beta 2 LFA MAC1 ICAM1 CD54. 11B C3b complement monocyte macrophage and NK cell. 11C monocyte macrophage and granulocyte and hairy cell leukemia. 14 is LPS binding PAMS receptor. 13 is MG monocyte and granulocytes. 1530 Reed Steinberg cells, classical Hodgkin's. 2045 Kopkon cells, lymphocyte predominant. 1656 NK cells. So what is linked with the NK cell? 1656. What is linked with the plasma cell? 38, 138, 78. Then 1920 pre-B and mature B. 20 also 21 is C3D. Roughly double of the CD11C. 21 is C11B, C3D. And 21 we get to drink it by Epstein-Barr virus, mature B cell. Then 23 and 25 is linked with the T cells. And then we have interleukin 2 receptor, that is CD25, and FOXP3. FOXP3 linked with the IPEX gene, that is also linked with the CD25. CD28, 28, CD86, 80, and B7. These are all involved in the co-stimulation. 28 is on T cell and B7 is on B cell. Then CD31 is in diapedesis, 31 PKM1 diapedesis. Then we have 33 myeloid progenitors and monocytes, myeloid and monocytes, and mature myeloid is 64. 34 is hematopoietic stem cells and 34 is in the rolling. 38, 138 plasma cells, 40 we know in the class switching, 40 ligand, 154, 41, 42, 61. So 38, 138 plasma cell, 1656 is with the NK cell, and 41, 42, 61 is megakaryocyte. 43 is Viscott Eldridge. 44 is METs and hyaluronic acid. 45 is leukocyte common. Common acute lymphoblastic leukemia is 10. 45 is leukocyte common antigen. 45 RO is memory T cell. And 54 we have already studied. 55, 59 DAF, MIRL, PNH. Then 64 is mature myeloid and 33 was myeloid progenitor. 71 transferrin, Burgers, Henoch-Schönlein, IgA nephropathy, mesangial IgA. 79 is linked with the marrow pre-B and matured B cell. Then 80, 86 B7, CD28 we have already done. 95 is the fast ligand. 99 is the Ewings and granulosa. Epstein-Barr virus was 21. Then 106. 106 is linked with the VCAM1 VLA4 integrin and is also involved in leukocyte adhesion. 106, 54, 31, and these all are involved in the inflammation events. 1 to 3, CD123 is involved in hairy cell leukemia. Then 152 CTLA4 is involved in the inhibiting the co-stimulation. 207 is involved in the Langerhans cell histiocytosis. So that are all the important markers. And one is CD56, that is in the Merkel cell carcinoma. So that are all the important markers summed up in one place. I hope it will be helpful for you in the final preparation. And if you like my content, please do subscribe my channel. Thank you.